Welcome to the Fort Stewart Army Medical Department activity, or MEDAC. From our humble origins at the outset of World War II, we've grown to over 1,800 military, civilian, and contractor medical professionals. As members of the largest Army installation east of the Mississippi, Winn Army Community Hospital proudly serves the men and women of the 3rd Infantry Division, Rock of the Marne. We understand the vital work you do for our nation, which is why our dedicated medical professionals strive daily to fulfill the MEDAC's mission.
We look more at clinical practice that actually applies to the patients. Like, for example, in the operating room, we have a universal protocol checklist, a safety checklist that's in place that we go through and check to make sure we have the right patient for the right procedure at the right time.
Quality care is utmost important here. Safety comes first because we first do no harm. And then second to that is quality assurance, because we know that whenever the express needs of the patients and the identified needs of the patients are met, then we have better outcomes.
Making sure we address every aspect of a patient's needs when they come in, that we don't glaze over the little things, that we listen to people when they're talking to us so that we don't miss anything that might be potentially big, and then making sure we act on those things.
We're in the business of preventing injuries and illness, and preventive medicine plays a big role in that. Prevention, we kind of help to mitigate those long-term illnesses, and we want to promote long-term health through our preventative services. By educating, bringing about awareness, and the interventional services that we have helps to promote that.
Not only are we taking care of the soldiers, we take care of their families as well. And basically, indirectly, by taking care of the families, we're still taking care of the soldiers, because a lot of it, their number one thought is while they're gone is, how's my family doing? I think they realize once they know that we're taking care of their family and taking very good care of their family, then it makes them feel a lot better while they're deployed and away from home.
We're very patient and family-centered here. We want to keep our patient's family involved because it helps the patient feel like they are truly cared for when we're encouraging their spouses, their loved ones to participate in their care.
I have been a service member. I've also been a spouse. So I can see things from both angles, and I understand some of the things that our spouses need, and I understand what an active duty soldier may need.
When patients leave here, after we've seen them in the emergency department, I want them to leave here feel that they've got top quality care, not just good care for the Army, the best care in the world, not the best care in Hinesville, not the best care in Georgia, the best care in the world.
Winn Army Community Hospital and the Fort Stewart MEDAC are key members of the Army's Regional Health Command Atlantic. That means no matter where you may be stationed in the future, anywhere in the region east of the Mississippi River, you can expect a continuation of excellence in preventative medicine and quality care for you and your family.
We want to give individualized care that will make us the hospital of choice.
Because at the Fort Stewart MEDAC, we want you to feel good about your health care.